Welcome to Back to Business, a program created to highlight local businesses here on Long Island. And today with us, we have Marc Berlin of On the Marc Advocacy Services. Welcome.
Thank you.
So glad to have you here.
Appreciate the time.
Yeah, thanks for coming. So you are the Marc of On the Marc Patient Advocacy Services, right?
Correct.
And you started this business, what, like in 2020?
Just before the pandemic.
Okay, that's a great time to start a business.
I didn't know the pandemic was coming. But it was after, I'll start from when the idea came to my mind. My mother was diagnosed with a brain tumor in 2015, and she succumbed to that in 2017.
Okay.
And 6 months after that, my father had passed away. So 2017 was very shocking. Mm-hmm. And my mother was there for me after going through 20 surgical operations stemming from cerebral palsy. Leg lengthenings, hip osteotomies, tendon releases, things of that nature. Mm-hmm. And I was the youngest of three, and so she was there for me. She spent a lot of time with me. Mm-hmm. So 2017 was not easy when I lost both parents.
Yeah, so 6 months apart's rough.
Very rough. I was in a support group at the Friedberg JCC under Gloria LeBeau. Mm-hmm. Wonderful support group for people who have lost a parent. And from that, I attended a session at the JCC through Eileen Karina's Pulse program called Patient Activation and Community Conversation, an hour-long conversation about various topics in healthcare and how to be better, take care of your health. Mm-hmm. And I just fell in love with that field. I thought it was only on TV and in the hospitals. I didn't know you could be an independent patient advocate.
Okay.
So from there, I found the Alliance for Professional Health Advocates, took their courses online, and during COVID, I did some research, took some classes, and worked on the business plan. And I've been working on growing it ever since. That's
fantastic. So what were you doing before?
Before that, I'm still doing compliance for an outpatient mental health clinic.
Okay.
Reviewing medical records. I've been doing that since 2013.
Gotcha.
But prior to that, I started my career in human resources, working at Parker Jewish Institute at Winthrop Hospital, the old Winthrop Hospital, which is now NYU Langone, and then moved over to provider relations, credentialing and contracting.
Okay.
Both primary care doctors as well as ancillary.
So taking all of your experiences, work, personal, professional, you combined it all and putting that all into advocacy at this point?
Yes.
Yeah. So did you find that when you went through this loss with your parents, that you had a hard time trying to navigate the system?
I had a hard time focusing. I wanted to find something that I could do to make a difference. Loss is terrible. Parent, sister, kid, terrible. Finding the support was challenging. Yes, I had my sisters, and I had, thank goodness, my friends from my synagogue at Young Israel, Lawrence Cedarhurst. But it took a while to find a great support group.
Yeah.
And that helped.
Yeah.
Because there were others that went through it.
And when you were with them, did you see the need by speaking to these other people that this was something that was necessary or needed patient advocacy,
Not in the support group.
Okay.
What happened was when Eileen Karina had her discussion, patient activation, community conversation, she spoke about various aspects of healthcare, going to the doctor, waiting rooms, washing hands, things of that nature. And it just brought on an interest. It sparked an interest. Because prior to working with the compliance, I was doing medical alerts for a company.
Okay.
So I was working for seniors, but it was commission-based.
Right.
And I wasn't making a living with it, and then the economy turned. So I had to stop that. And I felt, once I found this field of patient advocacy, I felt like I could make a contribution and assist others in their journey. Because for me, growing up with cerebral palsy was very tough, very limiting and difficult in physical as well as when I also have a learning disability. So it made things challenging, but I overcame a lot of obstacles.
Right.
So if I could assist either family with an adult with special needs or physical limitation, or an older aging individual whose kids are worried about the individual living alone, but the man or woman wants to stay at home, age in place, so I could assist with either appointments, making sure their home is safe,
Yeah.
making sure that they have everything listed correctly, and medical alerts or home health aides if they need it. My goal is to be a resource for them and to give peace of mind to the family
Good.
as an advocate.
And so I've read a little bit about patient advocacy, and so it's like you help them, like you were saying, in the home, safety, you go kind of do stuff with the insurance, right? You help them navigate the whole
There's various
system.
aspects you can do. I focus on those wanting to stay at home, whether it's in a house or an apartment.
Which is aging in place.
Correct.
Yeah.
Now, some might do placement in assisted living
Right.
facilities. Some might concentrate only on billing and claim issues.
Okay.
I work with that because I spent nearly 10 years working for HMOs in provider relations and credentialing and contracting of both providers and ancillary services.
So you're familiar.
So I'm familiar
Yeah.
on that aspect. So I have I'm working with a client now was in a nursing home, but it wasn't covered. So I'm working with the insurance company to make sure that work on the appeal.
Okay.
Make sure the doctor resends in the information and see if we can get that covered and paid so the client's not responsible.
I mean, and that's a huge help. First of all,
is.
people don't even know where to start half the time, right?
Correct.
And then they're just confused and their heads are cloudy, and you just need somebody to think straight for you.
Yes,
Often, right?
sometimes you need an objective person
Yeah.
to guide you along.
Yeah.
Sometimes it could be, I helped out someone's mother who the doctor wanted to give her medication and wasn't covered by her insurance. So I called her insurance, and I found out that what the doc needs is to fill out a form of medical necessity so that the prescription would be covered by insurance carrier. Small things like that,
Yeah.
which means a lot to the family.
Right, which, seems easy to you, but somebody who's emotional and, not thinking straight, it's...
Right. Another example is doing an assessment for someone's mother who lives at home, but she wants to make sure she's safe. She's on a walker, and she's concerned about falling.
Right.
So making sure there's nothing, when you walk in, nothing she could trip on, making sure there's non-slip mats,
Yep.
raised toilet seats if needed to get up and down easier, grab bars in the shower, as well as bed railings. Because you don't want to lift up next to the table,
Right.
the nightstand.
Right.
You want to have a secure footing.
Yeah, especially at night.
Yes.
You need to
Well,
get
actually,
up.
you have a nightlight.
Yeah.
All right.
Yeah.
Make sure things are accessible. Make sure things are at reach in the kitchen.
So like a home evaluation, the safety plan,
Correct.
and insurance help, medical forms, doctor appointments.
To help assist with doctor or finding a specialist,
Okay, I'm finding a
as well as
specialist.
getting organized.
Yeah.
I'm I'm an ambassador with the Take Charge campaign
Okay.
under the Pulse Center for Patient Safety, Education, and Advocacy. And those are 5 steps to safer healthcare, which includes having a healthcare proxy, making sure that you know who you want to speak with if you can't speak for yourself. And that's so important, not only for a senior, an older, aging individual,
Yeah.
but a college-bound individual. If they're going away to school, you want to have the information so that the doctors can speak with you.
Yeah.
Right? Things preparing for your doctor visits, having questions prepared, bringing someone with you, having your medications listed
Yeah.
on a form or on a USB, and knowing the doctors, knowing your primary and specialists to keep the open lines of communication, and most important, washing your hands, preventing infections.
Hello. So I think that's actually interesting because I'm seeing at my age and my friends, our parents and our aunts and uncles, they're all getting older and they're all starting to need help in one way or another. And we're a little lost. We're trying to figure out and navigate the systems ourselves. So is that something you work with too, like families or like daughters, children of those who are getting older to help them navigate the way?
Exactly.
Yeah.
Lending them a hand.
Yeah.
Because they're in shock also, especially when they get a diagnosis, when the mother or father, aunt and uncle get a new diagnosis.
Yeah.
It can be very tough.
Yeah, and sometimes it happens really quickly,
Yes.
and you just,
And you don't know where to turn.
Yeah.
You don't know what to do. You have to find a specialist.
yeah. Specialist, fix the house, get your insurance together, find sometimes somebody to watch or help them in the house as
Yes,
well.
home health aid.
Yeah, home health aid,
companion,
exactly.
Getting the medical alerts.
Yeah, all of that, all of that. And it's
It's a process. It's a process.
a big process.
Especially when you have to go to the hospital and the family's not in the area.
Yeah,
All right. And then you have to go to a nursing home for rehab.
exactly.
Who's taking care of the house? Who's watching? Who's paying the bills?
Right, right.
Working on the transition, the discharge from the nursing home back home.
Absolutely. It's, I don't think it's something that everybody thinks of, but when you're in that situation, boy, you're sweating.
Right.
You really
Yes.
are. It's a lot. It's really a lot. So I think that it's fantastic, that this service is even around, because I don't even know if it's always been around. Like, it's fairly new.
It's a fairly new service. I found out about it in, I guess, 2017.
Yeah.
Others have been doing it for, that I know, for 20, 30 years.
Oh, okay.
But I just found out about the industry.
Yeah.
And about the certification. I didn't know that there was a certification from the Patient Activation Certification Board. And I became board certified. I took the exam and I passed. I'm now board certified. I took the exam in 2022.
Oh, I'm glad you passed.
Thank you. Me too. It was a tough
Otherwise,
exam.
what are we doing here?
No, it helps to establish trust.
Yeah.
And it lends to credibility.
Right.
And it shows your knowledge about the industry.
Of course. Yeah, of course. I think it's great. So now, you started talking a little bit, but what organizations do you work with?
Well, I am on the board of several organizations. One is Destination Accessible.
Which is?
I'm a board member that provides online assistance for those with mobility challenges.
Okay.
Whether it's parks, museums, restaurants, you can go on the website and see if it's friendly enough. All right. Parking outside, restaurants, is the bathroom accessible? Can you get a wheelchair through?
That's interesting. Just sidebarring.
Yeah.
I find it really interesting how many restaurants don't have accessible bathrooms.
I know.
I have bad knees. Going up and down the stairs is not easy.
It's not.
Yeah, it's really interesting. You would think that had to be a law or rule.
Well, it came about, the Americans with Disabilities Act, which was passed this month in 1990, came about for those reasons.
Huh.
Both establishing businesses, establishing guidelines, people who are working, who have a disability, who want to apply for a job.
Yeah.
Can you do the job? But you just need a reasonable accommodation.
Yeah. I'm so sorry I cut you off.
So I'm part of that. I'm also the secretary for the Alzheimer's Disease Resource Center, which is in East Islip, provides services for not only the family but the caregivers. And we have music therapy, art therapy, and the social worker will go out and help and provide resources here on Long Island. I'm the membership chair for the National Aging in Place Council of Long Island.
Okay.
And I joined also the National Association of Healthcare Advocates. I'm on the board for them. It's a national organization. And I'm also a volunteer with Pulse Center for Patient Safety, Education, and Advocacy. And I participate in their programs.
So you don't do that much?
I do quite a bit.
You do a lot.
Do that,
You
and
a lot.
I have a personal training program that I'm part of with a trainer.
Oh, okay.
Yeah.
And what's that about?
It's a one-to-one fitness. Her name is Abigail Schwartz, and she's done some amazing things since 2020 with me.
Great.
Including hex bars, pushing the sled, TRX machines, and lifting weights in both arms independently.
Fantastic.
Yeah, so big achievement. I think it's important to have something that you're striving for away from work. Personal achievements, and I definitely feel that I'm making strides.
And you're always learning. So you're helping
Yes.
and learning at the same time,
Correct.
right? And
Yes.
I think it's really helpful when you're in a profession that you have personal experiences and that you could connect to people.
Definitely.
So you know what people are going through.
Fortunately, I've been through the surgeries, and I've been through situations with my parents,
Right.
especially my mother when she went through the brain tumor. But my father also had heart surgery. He had 2 kidney transplants. My mother gave him the first one, then he had another one 11 years later.
Wow.
Yeah,
That's a lot.
it's a lot.
That's a lot, yeah.
As well as having the learning disability, but graduating high school, graduating college from American University, getting my master's from the George Washington University, and now a board certified advocate.
Yeah. So you're a good example for people of,
Yes.
what you can accomplish.
Correct.
You know?
If you set your mind to
You
it
have to set your
and
mind to it.
overcome obstacles.
Yeah. And keep the bar high. Don't set it too low for yourself.
Don't set it too high. Set reasonable.
medium?
Set reasonable.
A medium-sized
Right.
bar. Let me ask you, what strategies or methods do you use to represent patients effectively?
It depends on the situation.
Yeah.
Okay. What I like to do, I do an intake
Mm-hmm.
to get the feel of what they need. Then I'll do an assessment and see where they should go.
Right.
And then for a plan of action, whether it's what I mentioned before with doing the home assessment, or helping a procedure or medication getting covered. You draw certain things out and you make a list of things that have to get done, and then put them in place. The other important thing is making sure to follow up, not just leave it alone, but to check in on people.
I think that's huge.
Yes.
Right?
Yes.
How else do you know if your plan's working, if you're
Right,
not
and to follow
following
up, a month or two later, or every month, just to see how's it going. Do you need anything? Anything okay? Something that needs to be modified, unplanned. Maybe something else came up.
Right. So I guess it's like either, like a one-on-one kind of thing, like I was saying, like I might need for my mother or my aunt or something just to get me kind of started, or somebody that needs you on a more regular basis.
Correct.
Right. Who's
Yes.
just like, maybe next month you come in, check on your bills, or your bills has that insurance coming along.
Helping
your
with the doctors.
Yeah. Setting
Or
appointments.
just doing that one-time assessment where we get the medications organized, the doctors organized, getting the house cleaned, and then coming back on a month or bi-monthly basis. So it varies, but I like to start off with the intake, do the assessment, present them with the assessment, and then follow up as needed.
Yeah. What are some of the challenges that you face, aside for the traffic?
Traffic. Dealing with insurance companies, getting to the right person because there's no direct number.
Yeah.
Sometimes you may have to deal with different family members because everyone has their own opinion on what's best for mom or dad or aunt or uncle.
Ah.
They're dealing with
Emotions.
especially when you're in the hospital.
Yeah.
It's tough dealing. Sometimes you have to coordinate a meeting.
Yeah.
Just getting everyone together can be challenging.
Yeah. But I would imagine that it's nice to have almost like you're like a mediator, somebody in the middle who's not taking sides. You're just trying to do the best for the person who is.
Correct. Best for the patient and trying to get the family to support the patient.
Yeah.
And doing what his or her needs are and her desires.
Right.
Making sure the outcomes are met.
Yeah. I think that's really important, actually, to have somebody like that. Emotions get too high, and
Yes.
you're just thinking of the one person that needs the help, and everybody else should get on board.
Correct. Yeah.
Right? So do you think it's important to help empower patients to become advocates for their own health care?
100%. It's so important to be prepared.
Yeah.
Not wait until the last minute. Now we don't know when something's going to happen. But if you're like the 5 steps to safer healthcare through the Take Charge campaign, having the healthcare proxy signed, right, having a power of attorney so you know what's going on, making a list of questions before your primary or specialty visit, right, knowing that, writing down the symptoms of certain things, what hurts, what have you tried, what makes it worse, what makes it better,
Yeah.
right, making a list of your medications and your doctors, both your primary as well as any specialists you have. So if you go from a doctor at Mount Sinai and you see a specialist at Northwell, you have the information with you. You could transfer. Making sure that you, the caregivers and the medical staff wash their hands to prevent infections, and having someone along. If a family member is not available for one reason or another, taking an advocate to make sure that their questions are answered and then reporting back to the family. And it's so important to have someone with you. Especially during COVID, I was taking a patient to his appointments. He was wearing a mask and was hard of hearing. And the staff was wearing masks. So they were talking, but the patient couldn't hear.
I find it to be really important when you're going to a doctor to be as prepared as possible.
Yes.
Because when you're in there, you forget. You get nervous. They say something. You're not always hearing everything. Right. I've seen that a lot with my parents as well.
And doctors don't always have enough time for the patient visits.
They don't.
Right.
I show up with a list of questions.
That's very good.
I do, because
everyone should.
Yeah, so they know what's happening. First of all, I have these questions.
Yes.
Sit down, doc, because we're going to have a conversation. And I think that you should be able to advocate for yourself. Like, don't rush me out. I need these questions answered.
Correct.
Right?
But it's also hard to be by yourself.
It
and
is.
not have someone with you.
It is, and sometimes you hear something differently than somebody else. You know what I mean? So it's easy. I think it's always really important to have
Absolutely.
somebody with you.
Parents take their kids to the pediatrician.
Yeah.
And then family practice and internist. Sometimes you want to go with your older, aging mother or father just to make sure that their questions are being answered.
Or they connect the dots because they're like, oh, I'm feeling okay, but like, and then the other person's like, well, remember you fell? Remember you were dizzy the other day?
Or medication.
Yeah.
So there's no interaction because you might get a medication from your primary doctor, but your specialist may prescribe something different.
Yes, that happened to me. My potassium dropped because I was on a different medication, but my one doctor didn't know, and I just happened to mention it, and she was like, well, there it is.
There you go.
I said, well, I should have told you, I guess. Yeah, so these things are really important. I don't think everybody thinks of them,
No.
you know, which is what you're here for.
Correct.
What impact do you think you're making?
I think I'm making an impact. I'd like to make a greater impact before I retire, before I sunset, but helping when things get accomplished
Yeah.
and the family member is happy with the service and they're able to get something to move forward. And if I navigated well with their issue, I feel like I'm making an impact, making sure they get their medical alert so they're safe if they need help at the push of a button.
Right.
Making sure that the procedure or medication is approved by the doctor. Helping a client get referrals, especially if they have an early diagnosis of, let's say, dementia, and eventually they have to go to a facility, memory care facility, having those resources available.
Yeah. Yeah. Like you're their rock, like you said
Right,
before.
I said, because when you get that diagnosis, you're struck, and you're in shock, and you need someone like, if not a family member, an advocate to guide you along and be there and be your rock, so to speak.
Even if they're not diagnosed with something, it's just aging, right? Just getting a little older.
Oh, definitely, because it comes with issues and things develop.
Yeah.
And family's not always around, they're not always in the vicinity, and you want someone to check in on them and be there with them.
Absolutely. So do you have any future plans, or what are your goals going forward with this?
With advocacy, I'm hoping to expand the field and promote it, not only locally, but nationally as well. Not everyone knows about patient advocacy, but it's so important that people know and be made aware.
Yeah, that this is available to them.
Correct.
Yeah.
You need someone. I mean, doctors don't always wash their hands. They're from one patient to another. We think they do, but it's important to ask politely and in a nice manner, but as well as medical staff. When you don't see that, you want to be more proactive, both patients and the families, in taking care of oneself.
Right.
I'm hoping to assist and guide others in their own journey, whether it's someone with a disability who needs help and wants to be independent, or an aging family member who wants to stay at home, does not want to go to assisted living at the moment, but the family's concerned. Are they okay to be home?
Do you find, I mean, I think it makes sense that a person does better at home only because the surroundings are familiar and they're comfortable there. If it's not a medical problem,
right.
I mean.
Every situation is different, especially if sometimes it's better to be in a facility, depending on the diagnosis,
right?
Because they could have more care 24 hours. And some people like assisted living facilities because everything's brought to you. You don't have to worry about the house or the lawn or driving. But my focus, because my mother wanted to remain at home during her process, didn't want to go to a facility. I was recovering at home during my surgical operations. And certain older individuals, it may not be their house, it may be their apartment, maybe downsizing to an apartment.
Right. One floor,
right.
stairs.
Correct.
Yeah.
That's important.
Right.
But I do agree with you. Certain older individuals like to be at home because they're familiar with it. That's where they grew up. That's where they have their family. And if they have their friends and isolation is not an issue, then I would recommend aging at home. But if isolation is an issue, or if you get diagnosed with a condition, you may have to look at alternatives.
Yeah, of course.
Placement alternatives.
Yeah, understood. So what do you see the landscape of patient advocacy evolving in the future? How do you see it evolving?
The way I see the field of patient advocacy, there are some national groups that exist, greater national advocates, in Chicago. There's the Alliance for Professional Health Advocates. There's Pulse here in New York, as well as the National Association of Healthcare Advocates, where I'm on the board that I mentioned before. And it's so important to families to be aware of these groups, and so that you could find an advocate if you need something in your area.
Do the hospitals tell people that these things are available? Like, how do you hear about it? How do you know?
Sometimes word of mouth.
Yeah.
I get a lot of referrals from elder law attorneys that I've networked with, organizations like the National Aging in Place Council, which is a great resource for people, whether it's an advocate, an elder law attorney, financial advisor, helping with community Medicaid, or placement for memory care.
Well, that's why we're doing this interview here as well,
Yes.
right? To let people know
And
that it's here.
keep the open lines of communication with a medical team.
Yeah.
That's very important. You may need to get a meeting together with all the staff.
Right. Right. So.
And I think it's important to educate and make people aware of the industry. And not to do it alone, because it's very hard to go alone. And we all need someone.
Everybody needs some kind of support system.
Absolutely. And the most important thing is to carry a medical ID card.
Oh, like this one?
Yes.
On the Marc Patient Advocacy Services medical ID card. So it's got your name, your phone, your date of birth. Oh, it's got your emergency contacts, your allergies, medications, medical conditions.
That's just a small example. If people have other longer list,
Yeah.
I have forms that can be sent. But I just think it's important to carry in case of an emergency.
Yeah, absolutely.
If not that, on your phone.
Yeah. So on my phone, I have like pictures of my meds.
Right.
So,
Yes,
to make
very
sure that
important.
I know. Yeah. But this is great. Absolutely. So is there anything else that you wanted to talk about that we maybe missed? I feel like we covered a lot today.
We did.
How could people get a hold of you if they're
They
interested?
could either go to my website, which is onthemarkadvocate.com with a C. They could email me at mark@onthemarkadvocate.com. I'm also on Facebook and Instagram at MSBadvocate21.
And what about these organizations like Pulse and all of these other places? They're all online as well.
Correct. Pulse is online. Patient Safety Education through Advocacy. Alzheimer's Disease Resource Center, which is based in Islip, ADRC Inc., destinationaccessible.org, and the National Aging in Place Council of Long Island, and NAHAC, the National Association of Healthcare Advocates.
There's a lot of resources out there.
There are. You just
There
have to
really
be
are.
aware or go out there and find. When one says no, doesn't mean it's the end. You just have to find another way to get to the goal.
Call you,
And call me at some point.
right? That'll
Yes.
be it. Well, I appreciate you being here.
Thank you for the time.
I
It
think
was
this
great
is
to let people know about the field.
Very informative, very, very informative. I think it's so important to have this service out there. And I'm hope that people, call you up, call somebody out, and are able to use this in the
Thank
future.
you.
Yeah.
Appreciate the time.
You're very welcome. And thank you for joining us. All of Marc's information will be at the end of the show. Stay tuned for the next episode of Back to Business.